58 years lady. 66 years lady complains of the severe back pain. Sorry, severe claudication pain with mild back pain for last 10 years. The walking distance is homebound almost for last 3 years, and claudication, severe claudication, 3 to 4 minutes. But we plan to compress it L4-L5 over the top and also the L5-S1. The left is more than the right symptoms, so we are approaching from the left side. This is the L4 lamina, this is the spinous process, and this is the facet, this is the L5 lamina. We have just started from the spinal laminar junction here, and then this to the lateral medial aspect of the facet, and this is the SAP or the superior articular process of the L5, which is very much hypertrophic. Now this is the distal end of the window, and this is the inferior lamina or okay. A lot of osteophytes here at the facet joint. And this is my inferior lamina here. I just wanted to detach the ligamentum flavum from the inferior lamina now. Here is the foramen, so I am just trying to trim a bit of the bone at the foramen, de-roofing the bone, de-roofing the foramen so that the nerve root will be completely decompressed up to the foramen. Spatula. Disc+Lcs. So very thick ligamentum flavum, which is one of the major contributor for the stenosis. This is my cranial petty, and this is the caudal petty. I am at the center or midline, protecting the dura both cranial and caudalic. 45. And then we are going to the midline. Spatula. There, 45. So gradually we have reached the midline now. These are the very thick ligamentum flavum of the midline. Now we have crossed the midline and going to the opposite side. This is the right side now. We are approaching from the left side. L4-L5. These are the thick ligamentum flavum. This person. So we are now changing our petty to the lateral gutter and trying to put at the petty at the cranial, at the shoulder of the nerve root. One more petty, maybe up to the foramen or axilla of the nerve root. We'll try it. There is a very severe stenosis. Negotiating the petty is also a difficult job. Yes, it is pushing back. Forty-five. This is the ligamentum flavum along with the hypertrophic portions of the facet of the opposite side. This is the foraminotomy of the opposite side. ଟିକେ ହଟେଇ ଦେଲୁ ଫୁଟ୍ ସୁଇଚ୍ଟା. This is the foraminotomy of the opposite side. This is just trimming of the little bit of the bone so that my trajectory will be direct and visualization will be better. This is the hypertrophic portions of the SAP of the opposite side. My nerve root is clear now, and this is the hypertrophic portions of the SAP on the nerve root. It's 45. We are in the opposite side now, and these are the hypertrophic facet or SAP at the foramen. Now it is the foramen anatomy done. Spatula. Photo. So this is the nerve root. I have decompressed up to the foramen. Very nicely visible up to the foramen. Completely decompressed. This is the axilla. नहीं फोटो नहीं चल ओके discourse so adequately decompress pulsation is well fed, well visible. This is my cranial petty at the left side. This is the caudal petty of the left side. It is the same side. The opposite side we done. Now we come back to the same side again. So this is the hypertrophic ligamentum flavum. This is the hypertrophic facet or the SAP. Osteoporotic bone, and this is my foramen. Again, this is the SAP hypertrophic portion, the medial portion. So lateral aspect of the foramen and the lateral aspect of the shoulder of the nerve root is visible. This is the foramen, the nerve root. I am pressing the nerve root and decompressing gradually up to the foramen. This is the bit of the foramenal roof. It is also de-roofing the foramen to decompress the nerve root up to the foramen. Yes. So decompression part is over now. And then discourse. We'll just see if there will be any disc or not. Spatula. much of the disc cursor. So we are not going to remove the disc here. Was gel foam, yeah. Photo, the gel foam, okay. There. Light on. So we will go to the next level, that is L5-S1. L4-L5 is bilateral adequate decompression over the top. Nicely decompressed the foramen also, bilateral nerve root up to the foramen. And we will go to the next level, that is L5-S1. Okay. 66 years lady complains of the bilateral left more than right severe claudication for 3 years, complain of the mild claudication for last 10 years, almost homebound for 3 years, no responding to any conservative treatment, non-diabetic, hypertensive, osteoporotic, severe claudication pain, the L4-L5 severe stenosis, and the L5-S1 bilateral lateral canal stenosis. So we are approaching from the left side. We have just completed the L4-L5 bilateral overfit of decompression. This is the L4-L5 level, and this is the L5-S1 we have just started. This is the first bite at the spinal ulnar junction. This is the first we started the spinal ulnar junction, and then gradually coming laterally, detaching the yellow ligament or ligamentum flavum. Gradually we are coming laterally at the lateral end of the upper end at the cranial lamina here. And this is the area where the ligamentum flavum attached most cranially. This is the superolateral aspect. Now we are going to the facet. This is the superficial layer of the ligamentum flavum. We have removed a bit of the ligamentum flavum here, and then this is the infralamina. This is the hypertrophic portions of the infralamina. So we are detaching the ligamentum flavum from the infralamina here. And this is the hypertrophic portions of the SAP. That has to be removed, the hypertrophic portion, to detach the ligamentum flavum, and also the hypertrophic portions of the flavum is the most important contributor for the stenosis disc. Now this is a very thick ligamentum flavum. We are trying to remove it flap. 45. So just like a hypertrophic person and like a loose body here, the broken osteophytes become loose, so like a loose body. Here the medial aspect of the facet, a lot of hypertrophic osteophytes. This is the SFP, superior articular process of the L5-S1. So this is the S1 vertebra superior articular process, which is the hypertrophied, a major contributor for the stenosis, and below that is the nerve root, the white glistening structure, which is the nerve root here, and I am up the foramen now. So foraminotomy done. Now at the shoulder of the nerve root, a lot of hypertrophic now 45 other. So just try to remove this hypertrophic portions of the medial aspect. Now we'll go towards the midline. We'll protect our dura with the petty, one cranial and one caudal. So this is my cranial petty. So left approach, this is the cranial, say lamina, the spinous process, L5 lamina, S1 lamina, this is the facet and the midline. Now one more petty we are giving caudally to protect the dura. We are operating with the help of 3D 4K 55 inches monitor with 3D 4K system, German Storch. The depth perception is excellent, magnification is very good. So beautiful illumination, magnification, 45, beautiful illumination, magnification. And 3D system, so depth perception is the best, you can say. Is the midline hypertrophic portions of the ligamentum flavum. This is calcified ligamentum flavum, ossified or calcified, you can say. So this is the, we have crossed the midline now, and gradually we are going to the opposite side. deep layer of the ligamentum flavum. This is the cranial end. And this is the caudal end. This is the inferior lamina, hypertrophic portion. We are just undercutting a bit of the lamina, undercutting of the bit of the lamina along with the hypertrophic ligamentum flavum. Lot of flavum hypertrophic portion, this portion. Now we will try to put the patty at the shoulder of the nerve root, the spatula, and then we will trace the nerve root up to the foramen. So this is my shoulder of the nerve root, severe lateral canal stenosis. Okay, so there is a nerve root here. Okay, 45. This person. So my illumination trajectory should be clean enough. 45. This is the nerve root. So I am on the nerve root. My angle is protecting my nerve root, angle of the carisson. I am gently rotating my carisson over the nerve root, and the angle of the nerve root is protecting and rotating over the nerve root, and then protected. This is the hypertrophic facet, superior articular process, or SAP, of the opposite side. Yes. So we are at the foramen now. Vedata. Ramara. Yes. चलो 45. So we are at the opposite side foramen. This is the foraminotomy. This is the foraminotomy. Yes. So the hypertrophic portions of the SAP removed. The foraminal roof has decompressed. Spatula. So this is the nerve root. Yes. Photo. Very nicely decompressed. This is my patty. Nicely decompressed. Photo. Yes. Disc for sale. Now we'll go to the left side again. Now the right side we have done. Yes, the nerve root is visible here. Patty. So left side almost done. Let's see if there will be any left out compressing material in the axilla of the nerve root. 45. So almost decompressed up to the foramen, and let's see if there is any left out. Yes, so very nice. These are the hypertrophic portions of the SAP. And this is the foramen, everything done. These are the nerve root which is decompressed up to the foramen. This person. Photo was that was so now L4 audible phone. Pretty with head. Sure. Thank you.